The sleeve gastrectomy is the newest bariatric operation being done with any real frequency. It works by taking the reservoir bag that a stomach is and changing it into a tube that interconnects the esophagus and the first part of the small intestine called the duodenum. The stomach is just converted into a pipe. Now the volume of the pipe is about the same size as the volume of a pouch after a gastric bypass or a pouch after an adjustable band is placed around the top part of the stomach. The result of that is that you feel full sooner when you're eating. The size, the internal diameter of the tube that's created is about the same size as the internal diameter of the opening outside of a pouch created with, as if you were putting on a band, or the pouch that you were creating with a gastric bypass. So mechanically, it's very similar to both those other two operations. Additionally, the rest of the stomach is removed, and with that goes most of the stomach's capacity to create a hormone called ghrelin, which makes you hungry. And so what we see after this kind of an operation is a profound loss of appetite, a very rapid weight loss that is sustained at least for a year. We're now seeing very good weight loss between 3 and 5 years after the sleeve gastrectomy. The enthusiasm for the sleeve gastrectomy comes from the fact that none of the long-term complications that we sometimes see after a gastric bypass or after an adjustable band are conceivably likely after the sleeve gastrectomy. For instance, after a gastric bypass, the Y configuration of the bypass and the weight loss that ensues creates the opportunity for the intestine to get twisted and produce what we call a partial small bowel obstruction. There is no change in the configuration of the intestines after sleeve gastrectomy, so we can't visualize a small bowel obstruction occurring afterwards. After a gastric bypass, sometimes the little pouch makes enough acid to produce an ulcer in the small intestine to which it's connected. Again, after sleeve gastrectomy with most of the acid-producing portion of the stomach removed, it's virtually impossible to conceive of how an ulcer would occur. After a gastric bypass, the other major complication that we sometimes see is iron deficiency, because iron is absorbed preferentially in the duodenum, and it's bypassed when you do a gastric bypass. But with the sleeve gastrectomy, the duodenum is not bypassed. There is no opportunity for iron deficiency. The band will sometimes wear its way into the stomach, or sometimes the stomach, much more of the stomach than you want, will slip up through the band and twist or kink. Those two important complications of the band, you can't conceive of them happening after a sleeve gastrectomy, because there's nothing to erode, there's nothing to slip. So what we think of, if you were to have a long-term complication after a sleeve gastrectomy, would probably have to be just weight gain. Possibly there's some opportunity for kinking or stricture or narrowing, but it's not something that we're seeing with any real frequency at all. Short-term complications after sleeve gastrectomy are, like after the gastric bypass, bleeding and infection from a leak. Those are significant. Again, in good hands, it makes this operation is done as safely as a gallbladder removal or a hysterectomy, let us say. So, and this operation can be, what we see in patients is a very rapid weight loss in the first year, much like gastric bypass, a profound loss of appetite, about 80% or more excess weight loss in the first year. And then the patient's job is relatively easy in maintaining weight loss.